Great. Okay. Hi, my name's Marco Brown. I'm a nurse that works here. So I'm going to do my presentation about nursing ratios within the nursing system. And the contents of the presentation are nursing staff to patient ratios, where the problems lie regarding that topic, and what we can do to either help ourselves get out of it or what we can do as providers. All right, and nursing, as you guys know, is very difficult to get into. As of 2017, 56,000, actually annually, 56,000 people apply to nursing school and don't get in. So that's a very, very high rejection number, and it's one of the highest for a lot of technical schools. There's also a huge demand to hire nurses, but there's not enough nurses coming in. That's also due, if you look at the high retirement rates, we don't have enough nurses coming in to match those rates as well. And so now about actual nursing ratios, they differ depending on each facility and each service that you're in. So for example, in the ER or EDs, the ratios are usually around 1 to 4. 4 is on the high side, a little dangerous for that. ICU is 1 to 2. The operating room is usually 1 nurse per room, and med-surg and telemetry, they're always a little different, but those are the ones that are usually the worst contributors of that. They usually have the highest nurse to patient ratios, anywhere from 2 all the way to 12 or 14 in some areas, which is very, very dangerous, and I'll get to why a little bit later. Okay. And yep. Okay, so even prior to the COVID-19 pandemic, there were actually nursing shortages already. People were already stretched relatively thin, meaning that we didn't have the numbers of staff to accommodate the actual onslaught of patients that were already coming in. And when COVID happened, a 245% increase in nursing was actually requested or required. And this led to a bunch of unsafe practices. For instance, patient workarounds. Workarounds basically means that you have to find a way to make a situation work, either due to, let's just say, N95s not being functional, so you have to make that stretch longer, or cognitive failures refers to just you being fatigued and making mistakes, like putting in the wrong vital signs or on the wrong patient, charting on the wrong patients, doing venipuncture on the wrong people. I mean, I'm not saying anyone did that here, but in general it did happen during the pandemic. And obviously, with all of that combined, is decreased patient safety. All right, and a study found every time you get a patient added to your workload as a nurse, patient mortality goes up by 7%. So, and that's within 30 days of an admission. All right, this is a Press-Ganey mean score. It's actually more of a scale regarding patient care and how they feel about it, and what your response time is to, for instance here, it's saying the nurse friendliness and then the correlation to promptness to a call button. That was not as important, but what that really is trying to say is that they felt that the nurses were nice and friendly. However, they weren't hitting the call lights on time, meaning that if we have 1 nurse for 6 patients and 2 call lights are going off, they can't be in 2 places at once. So that's what that's kind of regarding. This one is a bit scarier for me. This is the same scale but in a different question. It's actually regarding if the patient felt ready to be discharged. And if you look down here, it indicates that they were discharged faster than they believed that they were ready to be discharged, meaning that we can't staff this many patients, so if they seem like they're okay, they send them out a lot faster, which is obviously is very unsafe, excuse me. All right, and the effects of high ratios, they go to retirement, burnout, income needs. That could be various things. Either we're not getting paid enough, or just the detriment of either working certain shifts. There's education requirements. There's always rumors about certain facilities requiring certain kinds of degrees to practice certain things, i.e. They keep saying that BSNs are going to be the requirement for RNs. Personal illness, that can be anywhere from having stress-related injuries to on-the-job injuries, or just fatigue in general. Mental health issues, which is very common in nursing. Staffing shortages, recovered pay, but there could always be discrepancies with how much you are getting paid. And then all this, to me, relates to unsafe working conditions as well. So one solution that they did come up with was back in 1999, California implemented the safe staffing laws, which is where they were only allowed to have 1 to 5, or actually 1 to 4, 1 to 5, depending on the facility and the type of care. 1 to 5 patients per 1 nurse. And what they did was they did a study 11 years later, and they found that it led to higher or better patient outcomes, and better patient outcomes. They found that the mortality rate that we talked about went down, and then they also found that if they were to apply the same model to other areas, like such as New Jersey or Pennsylvania, they would go down 14 and 11%, just with that one simple change. And these are other tenable solutions. These are actually just mostly my suggestions. If they would reduce nursing school entry requirements and lower attrition rates, that might help maybe the creation of new nurses and possibly help the shortage, and then increase staffing. I'm not sure how they would do that. Maybe bonuses or whatever have you, and then increase pay to help staff retention. So take care of the nurses that you currently have, make sure that they get what they need to keep doing the job. And that's it. And basically, if you have a high ratio of patients, I mean, always speak up about it. Be very vocal, and make sure that they know that it's actually very unsafe, and just speak up. All right.